Welcome. We've been sent a case today to evaluate for implant placement and bone grafting. This is a relatively unique case, but a very common occurrence. So what I want to do is review the plan and then also review a technique using a clinical example of grafting around this. So this particular patient is missing tooth number 18, as you can see, and he or she desires a replacement tooth. So we planned an implant, and just to kind of briefly go over our implant planning, you can see here mesiodistally we're a little bit close to this root, but that's done to be able to allow us to get the implant pretty well centered at the head of the implant between the edentulous base so that we don't have a cantilevering effect. And also you'll notice that my occlusal plane is definitely pointed a little bit up, but that was done because of this large diverging root here on the first molar. We didn't have the ability to get this correct, because to get it correct we would then need to place that implant into the root. So instead we simply chose to go ahead and accept a compromised implant position in this particular case. And then we can see on our occlusal table we're pretty well centered here between the ridge. So there's our lingual, there's our buccal, our distal, and our mesial, and here we are basically right in the middle. So that looks pretty good there. So in looking at our cross-section view here, though, what we can see is the outline of the bone, in comparison to our implant. So what we can see is that we have this much of the implant thread exposed. So what are our choices here? One option, not that this is a good option, is to drop the implant so low. That could bring the nerve into position, but we could certainly make the implant shorter. But the big problem here is this is definitely a no-no. Look at our crown to implant ratio, and also look how deep this is in the bone. This is this truthfully is a very not ideal situation. So I would, in this particular case, recommend leaving the implant at the top of the ridge, and then doing some grafting. So in terms of the grafting, one option is to do lateral grafting prior to implant placement, or using some of today's biologics, either BMP or more commonly using PRF and centrifuge plasma blood. We can actually use sticky bone technique and do ridge augmentation at the time of implant placement. So when I see what I evaluate for that is one, how much of the implant is exposed, and here we can see not very much. And then B, will the implant be stable? In other words, is the implant going to be stable in bone? And we can see that nearly 80% of this implant is actually in the bone and stable. So here we're just literally trying to graft just this area right here. So in trying to graft just that area, I'm personally quite comfortable just adding graft at the time of placement. So that would look something like this. If I can get this over here. So one second. That would look something like this. So here's our patient. Here you can see we have a deficient mandibular area here, and there is our flap blade and extended, and we've made a releasing incision here so that we have some flexibility with the area. Our surgical guide is placed, and then from here we will do our osteotomy, place our implant, and here you can see the implant threads exposed, and you can see we went ahead and decorticated the buccal area of the mandible and even onto the occlusal area a little bit to give us some bleeding points in the area for blood supply and for some stickiness of the bone. And then we will add our PRF sticky bone mixture in here. This is mineralized freeze-dried bone allograft material, and then From here, depending on your personal preference, you can place a PRF barrier along with a collagen membrane, or just a collagen membrane and then suture the area closed. And here's what the site, let's see if I have a picture. I don't, unfortunately. And then allow this to close. And in my practice, in my hands, in the right situations, we're finding good results with this type of grafting at the time of placement. So hopefully this is helpful and makes sense. And I would see zero issue that the person submitting this case couldn't be comfortable placing this implant and grafting at the time of placement. Thank you, and I look forward to additional cases.